It has become a practice in Africa for organizations to subject new employees to a form of pre-employment medical examination. In fact, some employers randomly conduct medical tests for their staff without considering it as an invasion of the employee's right to privacy. During the period of this medical exercise, some staff members are gripped with the fear of exposing their state of health and its consequence on their employment status. In this short clip, we seek the opinion of our learned friend and a medical practitioner on the legality of this practice. They would also be reacting to the inclusion of HIV/AIDS and Hepatitis B in this medical screening.
Yes, it is lawful. The Nigerian Labour Act actually provides for pre-medical tests. But the expenses will be borne by the company or the organization. The organization has to be the one to provide for the medical expenses, and then they have to also choose their own preferred medical outfit to conduct the test. But there is a limit to the kind of test that can be conducted. Of course, we are looking at medical tests that have to do with mental stability, level of sugar level, and then those are normal medical tests that should be conducted. But there are some optional ones that the consent of the employee, of the applicant, must be sought. So pre-employment medical test is legal.
Yes, it is actually lawful because it's in the labor laws, even of Nigeria as well, for an employer to conduct medical examinations on new employees and even old employees, so to speak. The pre-employment medical examination is meant to evaluate the new employee to assess whether or not the person is fit for the job, and the precise medical tests or investigations that are done should be juxtaposed with the activities of the new staff. That's what is required of the person on the job. So that is what guides the design of medical investigations that are to be done precisely. And then the other thing we have is periodic medical examination, which is conducted on existing staff, that's old staff. The essence is to evaluate their health status to be sure they are still fit to do the job adequately, and then to find out if, in the process of carrying out their duties on the job, their health has not been compromised in one way or the other.
It is not out of place for an employer to conduct medical tests randomly for the employees. This is the reason. There are some organizations that, whether they like it or not, they need to keep doing what we call health audits of their employees. Now, the issue of discrimination will only come to place when maybe an employee is also doing the same work with some other employees, and those other employees are not being asked to go through that kind of medical test. That's one scenario. Another scenario is maybe you are in a factory where they are involved in food production. It is ideal that the organization will not just rely on the pre-employment tests. They need to keep conducting tests to be sure that the employees are fit and proper to keep working in that organization. Like if you are working in an hospitality industry now, or you are working where they are involved in handling of food, it is just ideal that maybe every six months, every 1 year, that the organization conducts some tests for such employee. That test too, the employees must be informed the type of test that they are conducting for them. Okay, that is where the consent and their consent for the optional ones must be given. But then, if they now, after conducting that test, what they now do with the test and what they now do with the employee is another issue where we cannot be talking about discrimination. For instance, now, food handling industry conducted tests for their food handlers. People were discovered to have hepatitis B. I strongly believe no matter the level of the hepatitis B declared, even though some medical practitioners believe that it can be managed, I don't think it is ideal for such employee to still be allowed to stay in a food handling organization. That is one angle. For the HIV, for the part of the HIV, there is a law, HIV/AIDS Discrimination Act 2014, specifically states that nobody should be discriminated against for being HIV positive.
Yes, it is actually within the right of an employer to conduct medical tests on the staff randomly, but it is also imperative for the staff to be aware of the precise medical tests that are to be carried out on him or her, and then to give a consent to it. That is very important because that way there will be no risk of litigation because it is actually it is a basic requirement so that you do not carry out tests on someone and then the person is not really comfortable or with such investigations being carried out on him or her. So you need to get their consent, and then by so doing, the healthcare provider who is conducting the medical investigations will now be legally able to share the information, that's the results of the medical investigation, with the employer because the employee has given consent. Because medically, you cannot share the details, that's the health status details of your patient or client with a third party without your patient's consent. In this case, the patient or client is the new employee, and then the third party is the employer. But the patient or the new employee carried along and being fully aware of the investigations that are to be carried out on him or her, and then consent to them, then that's where you are free as a medical practitioner or healthcare provider to share the results with the employer.
It is not a must, especially where the organization is not into what I can call a special or specific operation that will require that kind of test. This is what I'm saying. Hepatitis B will only be applicable or will only be reasonable for hospitality industry or food production companies. It will be out of place to insist for a field worker, a mechanic organization, or a civil engineer to be compelled or to be asked to go for to do hepatitis B. It can be argued that there is an attempt to discriminate against such a professional. But if somebody who is in the food industry is being asked to do it, I don't think it's out of place. That is regards to hepatitis B. But for HIV, irrespective of the organization you work in, whether it is food handling industry or normally even in the bank, you should not be discriminated against based on that.
Yes, it's not in every single case, but for some particular employees, HIV virus screening and hepatitis B surface antigen should be included in the pre-employment medical evaluation. For instance, if you are a doctor and you are a new employee of a hospital, the employer has every right to find out your HIV virus status and the hepatitis B virus status as well because of the risk on the part of the patient. Because if you are a doctor, for instance, and you are supposed to carry out some surgical procedures on the job, and at the same time you're supposed to set intravenous lines, you're supposed to take blood samples sometimes, and so on. For this reason, for such a doctor, if he or she was HIV positive or hepatitis B virus positive, there will be a great risk on the part of the patient because he or she can actually be infected by the doctor. So, depending on the nature of your job, hepatitis B virus surface antigen and HIV virus screening are actually would actually be necessary for some particular jobs. People who work in the health sector, people who work in the food industry, especially who are involved in either production of food or processing and all that, because that's way they can easily, especially if there is a wound, if they have a wound or a needle prick or whatever it is, a blood leakage from any part of the body can actually contaminate food that others will have to ingest, and that's a risk. So it depends on the nature of your job. But if you work in a bank, for instance, your HIV status or hepatitis B virus status is not absolutely necessary because of the nature of the job.
Now, to answer that question, it will be wrong for us to just answer it in the abstract. The Nigerian Labour Act, Section 8, specifically provides for medical tests to be conducted at the expense of the employer. It didn't spell out the items or the type of test to be done. But I know as of practice for some organizations, when they are giving you the form, the test they expect you to do will be contained in the form. And from my own personal experience, when I was going to law school, I know that in the form, there were some items of medical tests that were supposed to be done. Same too for the Nigerian Navy. And I don't think it will be out of place for an applicant or prospective employee to ask to know the type of test they is being asked to go and conduct. I don't think it's out of place.
Actually, prospective employees have every right to know every single test, medical test they will be subjected to. They have every right to know because they need to give a consent before you can conduct the test on them to start with, and then before you can share the results with a third party, in this case the employer. So they need to know, and then they need to give a consent. It's absolutely necessary.